If anyone is here, please feel free to say hi and say something in the chat box. I'm gonna wait till a bunch of people get on here before we get started. And I want to just make sure that you guys can hear me. So if you can, please type hello or hi or say your name in the chat box. That would be great. Oh, perfect. Can you hear me? Perfect. Is it clear? No background noises or anything, right? Excellent. Thank you. This is so exciting. I'm going to wait for a few minutes until a bunch of people get on here. And then we will get started. I'm really excited to have you guys here. So how is your day going? Whomever is on here, Francine, let's see, Rick. So glad you guys are here. Oh, thank you. It's so sweet. Thank you so much. Let's see. Hey, Rick. I'm so excited you are here. This is fantastic. So great. While we are waiting, prepare some notepads or something to write, take some notes down. We're going to wait a little bit longer until more people get on here. So, and then we'll get started, okay? So, how is your day going so far? It's a Monday, it's the new year. Still can't believe we're in January. What did you guys do on the weekend? Give me something fun. Give me some good news. We need some good news in these days, right? Something happy. So feel free to share. And then we'll wait just a couple more minutes and then we'll get started, okay? In just a couple more minutes and then we will get started. I'm really excited. You caught up on sleep? That's good. That's important, right? Same. I was actually supposed to travel and then I canceled my trip and stayed here and rested a bunch and worked on these webinars and other health-related programs that I'm so excited to share with you guys very soon. Actually starting today, but just finished another program that will be launching. Hi, Lorene. Rest is good. Yay, you're here. So excited. This is wonderful. I know we had a bunch more people register and there's only several on here. So just one more minute and then we'll get started. Yeah, sleep is good, rest is good, travel is good, sunshine, right? All the important things to help your health and mind happier. Okay, I am going to start by sharing some of my slides and we are going to get started. This is recorded, so it will be available for people to see it after too. So we're going to start in 1 minute or less. In the meantime, I'm having a rosé all day kombucha, one of my favorites. Okay, so I'm just going to go get started, and hopefully more people will jump on board. But I am so excited to have you guys here. This is one of my favorite webinars on thyroid health, and many more to come. And this is something that is really dear to my heart, and I will share why shortly. But I wanted to let you know that at the very end of our time together, I'm going to invite you to work with me one-on-one and to overcome your thyroid hormone imbalance and to really find the root cause of what's keeping you stuck and unwell. So please stay until the end, and an offer will show up at the end. Okay, so stay with me. And we are going to be talking about the real reason why you cannot conquer your thyroid hormone imbalance symptoms. A lot of people are dealing with those issues and they're not even aware that they have it. But basically, if you've ever been diagnosed or have dealt with any hypothyroidism or Hashimoto's thyroiditis, which is autoimmune disorder, goiter, which is large enlarged thyroid, hyperthyroidism, Graves' disease, thyroid nodules, thyroid cancer, or if you are dealing with any symptoms like weight gain, puffy face, constipation, insomnia, skin changes, so dry skin, joint pain, depression, anxiety, night sweats, brain fog, hair loss, memory issues, low libido, which is also a huge sign of thyroid imbalance, and anxiety and mood swings, of course, then you are certainly in the right place. I'm going to leave this slide up for just a moment longer for those who are joining us. We're talking about thyroid health, but yes, if you have been dealing and struggling with those symptoms, then you are in the right place. So, as you know, the thyroid is a butterfly-shaped gland that's sitting in our neck, and it's responsible for so many health and metabolism in our, our organs and our cold and fatigue and mood and everything else. We will discuss more of it, but I really love this little illustration here to show you about the thyroid. It's a clear explanation or little symptoms, and it's just a beautiful one. So I really love it. But basically, stay with me until the end. I'm going to share a lot of information about how you can overcome your thyroid issues and treating the root cause and not just the symptoms, and why you haven't been able to do so until now. So focus and stay with me. And if your phones are on, if your browsers are on, if the dogs are interrupting, if anyone's calling, just make sure you're in a quiet room so you can really focus, okay? You also notice that there is that little chat box here on the right, and you can type in your questions. Preferably, I prefer if you wait until the end, so then we can go through the questions and answer them. Okay. Yeah. So let's dive in. Just a little bit about me. I began my holistic medical practice about 14 years ago, and I went into generalized practice like most of us acupuncture doctors. And I thought I could do it all, and I thought I could be, the jack of all trades, but the master of none. And I realized it really doesn't work that way. And I joined a practice for triathletes, athletes. I'm a triathlete myself, and treated a bunch of athletes, women athletes, male athletes, and patients who have completely suffered from hormone imbalance, not just because they are athletes, but I've just seen a variety of cases, and I always feel like the hormone imbalance is a big deal, and especially thyroid, because so many people are unaware that they have it. You can't hear me very clear? Okay. Can you hear me better now? I can take those headphones off and maybe see if you can hear better. Can you hear me okay now? Say yes or no, please. Okay, thank you. Um, I'll speak slower too. So basically, I had a lot of patients who come to me and say, I don't feel right. Thank you, Francine. I don't feel right. I'm tired all the time. I'm feeling off. I don't know what's going on. And um, I was actually one of those patients. And it's been many years ago when I suffered from that. And I will share that in a moment. But this is why I'm here, because I know how to attack it from every direction and how to help it. And it's one of my favorite topics to discuss. So I'm an Ironman triathlete. My background is swimming and running, and then I added cycling, and then I just did an Ironman a year ago, just a little over a year ago. And I, my entire life, trained very hard, and thank you, Dina. And I didn't eat properly. I never really ate meat, but I ate too much dairy. I ate too much croissants and bread, and things that are just detrimental for your health. I stopped my menstrual cycle; just didn't show up anymore, and I gained too much weight. I was too puffy. I was exhausted. I kept training, thinking, this should help me lose weight, and I'm not sure why I'm not. Um, it just was a complete it was a nonstop cycle of being tired but trying to get up and trying to exercise and trying to eat right, or I thought I was eating right but I wasn't. And I realized something was not right, and every doctor that I went to just said that it's all in my head and I'm depressed and that I should be on these medications for depression because there's nothing that they can do for me. And so I was like, there's no way I'm taking any of this. I'm a happy person. I'm not depressed. And no, I think you guys are wrong. And I went from one doctor to another. I finally found a holistic doctor and started an acupuncture and nutritional changes. And that really saved my life. And I've completely transformed and reversed my thyroid issues, and was able to take care of myself better and lose 25 pounds and feel better and exercise and do all these things that I always loved, and just feel my best and probably look better than I have before in my 20s and my teens. So, um, supplements, nutrition, all these things that I will be discussing a little bit, but these are the things that really, really helped me figure out why I was not feeling well. And it was actually my thyroid as well as food allergies, which a lot of people have and they're unaware of. So that's in a nutshell. And this is why I am here. It's not just because I've helped myself, but I've also helped many other patients regulate their hormones naturally and help them detox, help them reverse the anxiety or reduce the anxiety, help their moods, help their depression, their insomnia, hot flashes, their weight, and so on and so forth. So it is so important to really address what's going on. But I still really see a lot of patients that just say, I don't feel like myself. And it's a common thread. And this has really become my purpose. And this is why I love helping people, because I know I can. And it just brings me a lot of light into my life. And seeing suffering go away is a great gift. And it's a great gift for me to know that I can help others. So, what I have learned, or the three main things that I've learned in the last 14 years in my practice, was the thyroid hormone issues are often get dismissed as it's all in our head, when it's in fact not all in our head, it's in our thyroid, right? So doctors are seeing patients and they're just completely dismissing it. They're telling them to deal with it. And patients are leaving their offices, the doctor's office, completely demoralized and completely unheard, and often with a prescription for antidepressants. I've seen that so much and so many years in my practice for patients. And number two is comprehensive testings are not usually offered by mainstream medicine. They usually just do the TSH, or I'll talk about that in a minute, but just a very basic test to see if you have any thyroid imbalance, and if there are normal ranges, then they're like, oh, you're fine. You don't have any thyroid issues. Go home or take a medicine and go home. But comprehensive thyroid testing is really key here to find out what type of hormone thyroid hormone imbalance you have. And really, it's the only way to figure it out is to find the root cause. Okay, so women really, and men, as I've seen both, do not have to suffer these debilitating symptoms. And I know firsthand that they are debilitating. I mean, when you can't get out of bed after 14 hours of sleep and you are doing everything you can to lose weight and you can't, and you're still not fitting in your clothes, that sucks. That really does. But women and men are not supposed to deal with it. I mean, they shouldn't be the case. And they're often told by their doctors that this is part of life. It's part of menopause. It's part of aging, and it's part of being a woman, or it's part of being a man, right? But it really is not in your head, and it's real. It's a real issue. I often see also subclinical thyroid issues, meaning the patients come in with all the right symptoms of, let's say, hypothyroidism, and the labs don't show it, right? And the doctors are dismissing them yet again. But subclinical thyroid issues are a real thing. So even if your TSH, let's say, is in the normal range, but it's going to be a little elevated, that is going to show me that you are dealing with some kind of a thyroid issue, okay? That's without seeing all the other numbers, all the other labs. Also, when you are completely balanced, you're going to feel so much better. So balance can be and will be achieved when we fix the root cause of the problem. So again, let's see why we are here. If you've ever suffered, and a lot of people do suffer from it, and they're not associating it with thyroid issue, right? So even elevated cholesterol, which I will talk about it, is part of thyroid issue. So if you have high LDL, which is bad cholesterol, and high, let's say, triglycerides, or in general high cholesterol, overall cholesterol, you should always look at your thyroid, especially if you're an athlete, especially if you eat healthy. Always look at your thyroid. So if you have constipation, headaches, insomnia, skin, mood swings, irregular heartbeats, another big deal. If you have hypothyroidism or hyperthyroidism, you can deal with irregular or rapid or too slow heartbeat. That is something that should not be taken lightly and should not be dismissed, and should be very carefully looked at, because it can be causing further health issues down the road. Okay, so we will talk about that too. So what does thyroid imbalance entail? Thyroid hormone imbalance. So as you know, the thyroid is that little pretty butterfly that I showed you earlier. It's a shape of the thyroid is a butterfly, and it's located in our neck, and it regulates our metabolism. And your thyroid, your metabolism, affects your hormones, your libido, your sex drive, your sleep cycle, your mood, your menstrual cycle, right? Your energy, your weight, so much more. Okay, that's why it's so crucial to take care of it. So basically, we have our pituitary, which is also known as the master gland, and our hypothalamus, and they both control the thyroid, right? So when your thyroid hormones drop too low, so we have T3, T4, which I will talk about in a moment. When that drops too low, the hypothalamus releases the thyroid releasing hormone, which is the TRH, which then alerts the pituitary to also produce more thyroid stimulating hormone. That's the TSH, right? So that's how they basically make more thyroid hormones. The two main hormones, as we know, for the thyroid are T3 and T4. And your main one is T4. That's 80% of your thyroid hormone. And then it's the inactive one. The T3, which is the 20%, is the active one. So I often see when patients come to me, if they are on levothyroxine or the synthetic hormone, thyroid hormone, which is only T4, but they're not feeling any difference on it. They're not functioning well on it. They're not seeing any results, any difference. It's often because their body does not convert the T4 to T3. So it's not doing any good. And I frankly really don't like the levothyroxine or any kind of synthetic thyroid hormone, it's toxic. And I do believe that it does and it can damage bones and osteoporosis down the road. I've seen that many times. And I really prefer, obviously treating it naturally, but combination of T3 and T4 is crucial. I do believe that. The ratio from studies I've read is not necessarily important, but the combination is really important. And you can get desiccated thyroid hormone, you can get from a compound pharmacy and others, and we can discuss that down the road, especially if you have those particular questions. But back to the thyroid, this is how it operates. So T3, T4, when we see in lab tests that the TSH is a little elevated, so the range could be up to 4 or 5, usually 4 in functional medicine ranges. If it's in the 3s, I like to usually, and there are other symptoms, either cholesterol or weight gain or unexplained fatigue, and you really just don't feel like yourself, I always treat it as if it's hypothyroidism, but then we do other tests to see what really is going on. So T3, T4, we're going to talk about the other tests as well. So as you know, hormones are extremely sophisticated chemical messengers. They are important. The entire body is interconnected, and it should be a beautiful symphony, right? And every biological process in our body relies upon a thyroid hormone. And this is really crucial. A balanced thyroid is connected to what we eat, right? The exercise we get, the toxins we absorb, and man, do we absorb so many toxins from the environment and what we eat. And I can talk about that briefly. And also the weight we carry, and of course the stress, right? Stress is going to be so detrimental on your thyroid and on your body in general, because it's going to elevate your cortisol. It's going to drop your progesterone. It's going to completely get your body out of whack. And we know that when hormone imbalance occurs is when we have too little or too much of one hormone, and that's when your body is out of whack. So a lot of the women and men that I see come in misdiagnosed. They're either being told that they're eating the wrong food, they're not exercising, they're depressed, they're getting proper testing. Again, this is so important to really take care of your thyroid and really figure out where it's coming from, so you can really treat it from the root cause. But we really can't treat the thyroid properly unless we know the type of imbalance that we have. Okay, so let's discuss that really quick. So hypothyroidism, right? That's one of the main ones you'll see out there, and that this is the hypothyroidism. Sorry, is low functioning thyroid. A lot of people have it and they're unaware. So if you have fatigue and sluggishness and all the symptoms we discussed earlier, if you are cold, you're really sensitive to cold, you are constipated, you are pale, your tongue is enlarged, your face is enlarged, your hair is being, you're losing your hair, you're gaining weight like no one's business. I mean, I woke up from one day to another and I was like 20 pounds over. And I was like, what's going on? This makes no sense. But this can happen, and this will happen with thyroid issues. And then also you're going to feel weak and you're going to feel depressed. You are going to have some memory issues. You're going to have a lot of those issues and signs and symptoms that I just discussed. Because the thyroid, again, plays a very important part in metabolism and our brain and a healthy body. So it's crucial because it's going to help regulate all these. Okay. If you're, like I mentioned, if T4 doesn't convert to T3, which is mostly done by a healthy liver, and this is another favorite topic of mine, is your liver health, liver detoxification, leaky gut, all these things. If your liver is not functioning well, we are going to have more leaky gut and vice versa, right? Which then will have less serotonin, and then we'll have less GABA. These are our neurotransmitters. If these are not in proper amount in our body, they're not functioning well, we are going to suffer from depression and anxiety. And I see that all the time. I mean, I was that patient. So every cell of our body needs our thyroid to function optimally. Okay, I mean, I really can't stress that enough. Thyroid is huge. It's very important. And these are not the things that you're going to see on standard lab tests. That's where I come in play, and I can order those, and we will discuss that. So the other thyroid issue that we are so familiar with, a lot of people are, is the Hashimoto's thyroiditis. And that is the autoimmune disorder, right? And that's basically inflammation. When your body is so inflamed, it is going to attack its own thyroid gland and create that hypothyroidism, Hashimoto's, basically, because Hashimoto's is an underactive thyroid gland. But that's an autoimmune that can attack you so quickly, and it can go in stages, right? It can come and go, unfortunately. So that is the major cause for hypothyroidism, and I see that so much. And we can do the testing for that, and or specific lab tests specifically for antibodies to find out if you have Hashimoto's or autoimmune. Hashimoto's affects middle-aged women. It affects women in their 30s. It affects women in their 40s, 50s, 60s. I mean, it can affect any age, but usually I see that in 30s and up, actually. So same symptoms. Again, we're going to have the fatigue and sluggishness. We're going to have exhaustion, constipation, weight gain, like unexplained weight gain that you just don't know where it's creeping out of. Memory issues, joint pain, muscle weakness, like I said, muscle aches, stiffness, puffiness, right? Puffiness is not a fun thing to deal with. Brittle nails, hair loss, all these things. Not fun, really not. Sometimes you just want to get under the covers and never leave because you don't want to be seen. And I've been that. I've been there. So if Hashimoto's is left unchecked, it can be very dangerous. It can create goiter, which is the enlarged thyroid gland, right? And it can lead to cardiovascular problems, like I mentioned, high cholesterol. It can lead to mental health issues, so depression, anxiety. It can lead to mixed edema, which can be lethargy and unconsciousness. So it can be very detrimental. That's why you never want to go undiagnosed or misdiagnosed and continue on a day-to-day basis and just not know what you have. Okay. So the other one is overactive thyroid, which is hyperthyroidism. When your thyroid produces too much of T4, thyroxine, right? And then it creates a lot of anxiety, irritability, insomnia, shakiness, weight loss, sweating, bulging eyes, it can be, bulging thyroid gland, hair thinning and brittle nails as well, diarrhea possibly, or any kind of bowel changes, sweating, like I said, and a lot of changes in your menstrual cycle as well. Not fun, especially not when it comes to heart rate. My gosh, I mean, palpitations and arrhythmias, not a fun thing. It's actually really scary. So are all these symptoms relatable to you? Or if you know anyone that is, I mean, this is a great information to pass along. And if you have ever dealt with it, and if you've seen those symptoms, you felt those symptoms, and you never know why, maybe that can be your answer. Graves' disease, again, is another overproduction of your thyroid hormone, and that is the bulging eye pictures. When you see patients with bulging eyes, that's more of that Graves' disease. That's when you know that they do suffer from hyperthyroidism. It can also affect your libido, whether it's erectile dysfunction or reduced libido, again, menstrual cycle, weight loss, heat sensitivity, not cold sensitivity, unlike hypothyroidism, right? So now that you have a better understanding from everything I've discussed, I want to share a little bit of some of my patients too, but I hope you're getting excited because I mean, there's great information and there is something that you can do to treat it. And I do have a lot of patients that come in after, doing crazy diet fads and pills and starvation doesn't work. It actually makes it worse. Different supplements and stool softeners and diuretics and you name it, they've tried it and nothing worked. And the reason why these things didn't work is because they never really looked at the root cause of what's going on. So how do you get your thyroid in shape? Few things, right? So first of all, you have to be proactive about your health, right? Make sure you reach out to your practitioner. I can help. And make sure you take care of your health. Make sure you exercise, you get enough sleep, you reduce your toxic load. And that is so important. Let's talk, I mean, phthalates, for example, like the synthetic perfumes, the perfume we put on our skin, the the candles we stick to our wall, or like those air fresheners, or any synthetic perfumes or phthalates, which can also affect your toxic load. Your laundry detergent, right? Which is normally very, very toxic, and you're wearing your clothes, you're breathing it, and that will affect your endocrine system, that will affect your thyroid, that will affect a lot of other hormones and issues. Also, nutrition is key, really. You want to avoid wheat, you want to avoid soy, you want to avoid any kind of GMO, genetically modified foods. You want to eat organic diets, right? Organic foods and fruits and vegetables, because glyphosate is a real thing, and it can and will damage your gut, which will damage your liver, which will damage your thyroid as well. So you definitely want to eat more organic, clean diet, avoid dairy as much as you can. If you like goat cheese, go for it. Try and buy organic, but avoid cow's milk or cow's cheese of any kind. Um, I highly recommend avoiding the wheat, again, because that can be detrimental for your thyroid and your gut. It completely messes your gut. And if your gut is messed up, guess what? Leaky gut is going to lead to leaky thyroid, leaky heart, and many other issues, right? Um, so that's in a nutshell. But finding out the root cause of your symptoms and really doing the panel for thyroid, for lab testing, which is what I do, to really get the proper testing, whether it's TSH, free T3, free T4, reverse T3, TPO, to see if you have any antibodies for Hashimoto's thyroiditis, which, as I discussed, is your autoimmune. Um, Also, make sure you take care of yourself, right? And enjoy life. And that's so important. Emotions are going to affect your thyroid too. So if you're constantly at home alone, which unfortunately is what they're telling us to do, which don't do that. Be around people who love you, reach out to people who love you and care about you, and get some sunshine. Be active, take care of your health. It's crucial. And enjoy life. Functional medicine is key, really. And functional medicine is very different than Western medicine. We look at the patient centered care and not just the symptoms, which is what Western medicine looks at. This is why when you're saying, I am depressed, I'm tired, and I'm gaining weight, and they're like, oh, you don't have anything, take this medication and go home. You're like, wait, there's much more going on, but they're not looking at the root cause. They're just looking at the symptoms, which is what we don't do. We look at the root cause. We look at labs, we look at nutrition, we look at lifestyle, toxins, emotions, environment, mitochondrial dysfunction, immune imbalance, inflammatory imbalance and markers, and so much more. And this is what functional medicine, which is what I practice on top of acupuncture, can help. So I want to show you a few of my patients that had this experience, and basically I've helped them figure out their thyroid health and figure out that they actually suffer from that. So let's take Vanessa, for example. She's a young lady. She's suffering from weight gain and fatigue, brain fog, night sweats, dry skin, anxiety, depression, all these complete subclinical or clinical symptoms of hypothyroidism, right? And clearly, I didn't even know that she was on T4. She was on synthetic thyroid medicine, which she told me later on, and it did nothing for her, right? And she had bad PMS, she had bad digestion. She tried everything over the counter. She even tried regular probiotics, which, you should not just buy probiotics unless your practitioner recommends a brand, because what's on the label and what's in the pill should really be important, the brand you buy. So don't just buy anything. Consult with a practitioner. But we did a wellness panel. I did a wellness panel and a comprehensive thyroid panel. and I found out that her antibodies were high indeed, and her cholesterol was elevated. Her iron was low. Her vitamin D was very low. And if your vitamin D is very low, my gosh, you can have so many other autoimmune disorders, which she had, if since her antibodies were high. So that indicates of an autoimmune disorder too. So we then started treating her with acupuncture and got her off coffee and soda, and got her on some high quality probiotics and supplements and nutrition. And she started feeling better right away. She stopped taking that synthetic thyroid medicine, which did nothing for her. And she started feeling better. And yeah, symptoms diminished. She felt better. Another one, Sophie, and she has also been struggling with fatigue and weight gain for many years. And she tried every diet and every weight loss pills in a counter and everything. And she exercised regularly, and her diet was perfect as she reported. Of course, every time they tell me it's perfect, and I ask what they eat, and then I kind of make not a judgment, but I then know that what they eat can actually really affect them, right? She also noticed that her hair was falling out. She was foggy headed, which are huge symptoms for thyroid disorder. And the first thing we did was run the lab testing, also did comprehensive thyroid panel. And lo and behold, she had also Hashimoto's, which is the autoimmune. And basically, her body was attacking her gland as well. She was shocked, of course, that her doctor didn't even tell her that. And unfortunately, they only did a standard lab testing, which didn't show anything. So she's likely been like that for a while. And by the time she came to me, it's a little late, but we can still treat it. So we immediately got to work and put her on protocols and nutritional strategies, and we healed her gut and basically treating her autoimmune. We also implemented some lifestyle changes and took care, addressed the chronic stress and, of course, cortisol. So her hormones were out of balance completely. Her cortisol was too high, progesterone was too low, and so we addressed that as well with nutritional therapies. And then she also had food allergies, which suck. As I said before, food allergies will make you gain weight. They will make you be tired. They will make you be cranky. They are not fun. If you're eating something and you don't feel well after that, pay attention to how your body responds. And really, it can really be, it's detrimental for your health because it creates more inflammation. Okay, so that can be treated, and we can do a panel for food allergies. Anyway, so Sophie, then we treated her. She lost weight and she felt better. So, bottom line, let's take a sip here of my rosé. Your thyroid is so important, as we know. It's going to affect every system, every part of your body to make you feel better or worse. So, two key factors is you got to make sure your nutrition is on par, and you have to have good eating habits and regular eating habits, not starve yourself. It's not going to help. It's going to make it worse. You want to talk to your practitioner, functional medicine practitioner, and order the right labs, right? And, both hypothyroidism and hyperthyroidism are really crucial. And if they go untreated, they will create problems down the road, and especially cardiovascular problems as well. So definitely pay attention to that and treat it. And let's see. So restoring gut health is crucial, as I discussed earlier, taking care of your gut, because your gut health will help your immune system. It will help your thyroid. It will help so many other factors in your body. So the right probiotics are crucial, right? And then omitting the wheat, omitting the soy, omitting the dairy, omitting the non-organic foods, and getting on a high vibration, plant-based and, organic meats, wild meat, if you do eat meat, diet is crucial, like eating the right foods for you, lots of fruits and vegetables, lots of organic fruits and vegetables, and lots of sunshine to soak up the vitamin D to make your body happy and feel good, and exercise. And thyroid is not a quick fix, right? And especially if you have Hashimoto's, it can be an on and off thing where you can flare up. And that does happen, unfortunately. That's why it's so important to constantly keep a low inflammatory diet, right? So you're not inflamed, so you're not suffering. And like I said, it's not an overnight fix, even through medications, it's not. So it takes a while for the body to really come back into homeostasis. So, so for the last 40 minutes, I've been sharing a little bit about the science, about the hormones, and a little bit about nutrition, and a little bit about things that we can do to help. And I'm here to do the same for you. And I would love to invite you to work with me one-on-one at this clinic. We can do online or at the clinic, and we can gain new understanding of hormone imbalance and what's really driving your stubborn symptoms, and how do we treat the root cause? What are the root cause? What's causing these problems, these inflammation markers? What's causing your fatigue? What's causing your your hypothyroidism, and toxicity, right? Because we discussed the liver toxicity, how it relates to that, as well as the gut health. We are going to expose the root cause. We are going to dive deep into the hidden factors of the hormone imbalance and how the nutritionals and stressors all influence our hormones. And then finally, we are going to implement different strategies to balance the hormones step by step, and create your own healing breakthrough. And that's what I do. And just a couple more testimonials. Have a lot of patients who went through my detox programs before, and they sleep better, they lose weight, they feel better. And it's really the root cause, I feel, of everything. If you're not detoxifying your body properly, you are going to suffer one way or another. And so I feel like in order for your body to heal, you got to peel those toxic layers so then you can treat the body properly. And I will discuss about my exciting detox program I just finished creating, and it's going to launch very soon again. New stuff, very exciting. But yeah, and then had a fighter in the military, and she came to me for gut issues and injuries, and thyroid issues as well, and fatigue, and started doing acupuncture and supplements, and she's feeling so much better. And then, of course, my Hillary, who has been patient for many years and has also gone through the detox and cholesterol, hormones, different things, and absolutely love what I have done. So so this is how you guys can start the process with me today. I'm going to show something in a second. So the first step is really to dive into a one-on-one, 1 hour hormone imbalance case review, where we dive deep and into your history and see what hormone type you are and how to heal it. Really, the most important part is to discover the root cause and figure out what testing type you need. And basically, in that process, we will identify the hormone type you likely are, and we will customize root cause testing, and we will customize food and supplements recommendations. And we will basically go over that for the next 3 to 6 months, and really, really help your body heal from the root cause, and for you to see the light at the end of the tunnel. I am going to offer a booking that is going to be showing in right now, actually. But basically, in that 1 hour hormone imbalance case review, we're going to be discussing what lab testing you need. We're going to address the root cause. Again, we're going to do the nutritional supplements, the lifestyle, the mindset, regular support, and check-ins. So of course, I'd be honored to serve you here and help you out. And normally the initial appointment is $300, does not include labs. With labs, it's a different price, but the initial appointment will do a complete assessment for your history and what's really going on. But today, if you would like to book, you can save $50, and that's just today, and it will be $250. So you can see that book with Dr. Hadar green button. If you would like to book an assessment and a case review, you are welcome to press on that. And it's a one-time offer for $250, so it saves you $50. And if you can't see that green button, you can press on that link. And let me see. In the chat box, I can also type in that link for you if you would like to, let's see, to do that. So if you can't figure out how to press that button, or you don't see the button, you can see the link to book with me. Yeah, so that would basically be our one-on-one appointment for thyroid, for root cause, to figure out what's going on. If you're dealing with any fatigue, if you're dealing with any health issues, and you really want to be heard, you really want to be seen, discussed, and talked to see, basically to figure out what's going on in the root cause, this is the place to do it. So you can book on that link or on the green button on that offer that stands, as you can see, on the green button. And so I really am so glad that you guys are here for the last 45 minutes. Thank you so much. I really appreciate it. And I would love to answer questions if you guys have any. And yes, this is great. This is fun. I would love to hear from you. And feel free to type in your questions if you have any. And contact me as well on my email, which I'm typing right now, so you can contact me directly. Yeah, questions, anyone, anything, ask away. Now is the time. Anyone? I'll wait just another minute to see if anyone would like to book, and can use the green button. So use that offer to book with me and save the $50. And again, use the green chat box to type in any questions if you have. I would love to hear from you. Okay, one more minute and then we're gonna be offline. Thank you for being here again. I really appreciate it. Thank you. Thank you so much. Yeah, I appreciate it, Rick. This recording, thank you, Francine. I will be sharing this recording as well for people who haven't been able to see it. Thank you so much, Dina. I so appreciate it. Thank you. Thank you. I hope this helps, actually. I hope you learned something, and I'm going to do those webinars more. And I am going to do a detox webinar as well, which I am so excited about, because like I said, if you don't detox, you can't function properly. Like, your body will not function properly. Thank you. I'm glad it helps a lot. That's good. That's great to know. Definitely invite your friends next time and share this webinar. I will have it posted. Share it, invite people. I'm going to do more of those. So everybody should know, everybody should have help. Everybody should, receive the knowledge and the information that they're probably not getting from their regular doctors and stuff. So I'm here to help and share and spread the love and the knowledge. So yeah. So thank you so much for being here. Does anyone else would like to say something? Good. All right. Thank you, guys. Love you all. Bye.